We're talking to Dr. KSanford from Tennessee State University, and the topic is African Americans and health and well-being. And we are especially concerned with the African American male in reference to this study that he's doing. And of course, Dr. Sanford, let's pick up where we left off the last time.
Absolutely. I think our national agenda from President Obama and the First Lady Michelle Obama certainly have an interest in this obesity issue. You may very well know that she has taken it on as one of her pet projects, and I think she's doing an excellent job at trying to inform the American public about this epidemic. And when we think in terms of his national health care plan, of course, just in general, it is indeed needed, but I think it also has a component in there of being preventive. And this would, of course, help save the American taxpayer if we could cut into that $170 to $200 billion a year type of a deficit just on issues related to health. So as I think in terms of this, looking back at the study, one of the theoretical models that we think will be very important in trying to help this particular group is to look at it from a diverse point of view, from a multifaceted point of view, to understand the social psychology of why people might have certain types of habits, bad habits, or addictions, such as overeating, looking at it from a counseling point of view. We have a person that's in counseling psychology and in health. We have a person that is very much related in health and sports science, and myself as a sociologist. So we're taking a multifaceted approach with the group to try to inform them, as we would take that model to inform an audience that is listening, and particularly males, that maybe our religious institutions might take on this as a task to go into their congregations and say, we need to start walking.
Because they do have a problem in that all you have to do is go to church, and you understand that that's the problem. Especially go to some of the church suppers and some of the other kinds of activities. That's a real problem among our institutional churches.
Absolutely. And to just observe it out in your everyday life. If you go to any place just to shop, you can just observe people who are, you just know they're just overweight. And we can do this simply by exercising and eating correctly. Sometimes it's a hard thing to ask people to do, but very simply, if you cut out eating many of the white items you might have, like white bread, white rice, and the sugars, and the sodas, and the sweet teas, and all of these things, and then exercise more, you will start seeing a change just with that. And then if you regulate when you eat and don't eat so late, because you're sleeping on food that's in the system that is not being worn out. And then, of course, as you increase in age, and if you're eating that way, it's going to increase in poor health as well. So there are avenues of trying to change this, and I think this is why the prevention part is very important. And prevention meaning even if you are at an overweight or obese stage, find out where you are, and then at that point start making some changes.
And so what you're essentially telling everybody is that it's never too, no matter what your situation, what your age might be, it's never too late to start being concerned about your age within this, what we're talking about here now.
Absolutely. That's exactly what we're saying. And to the point of looking at the research that we are doing from in adolescents, we are hoping to maybe make some type of impact with them to get them to curtail their bad habits and make some change, you know, on the college level. And we're hoping, as I'm presenting this research in March at the Association of Social and Behavioral Science Conference, that it will be outreaching to a lot of other scholars that will come, and then hopefully it will be an article where it will impact another audience to help them. But programs like this is really excellent in doing outreach to everyone to see that, one, that it's a problem, two, that the problem is solvable, and three, that we need to get on board and to do something about it and start doing some things differently. Stop using so much salt and thinking about what we're eating and how we're eating and how much we're eating, and cut back on the desserts and things like that, and or stop it all together, you know. And in many of my presentations that I use myself as an example, I was at 250 at one time with 48 weights, and I had to stop and realize that, hey, I have to start changing and doing something different. Now I'm at a 36. And so, you know, you can change and do something.
Impact on your own. You know, when we talk about institutions, and I think you're dealing with an educational institution, but what about the food services and situations in those, you know, the presence of Coke machines,
yes, right. I understand exactly what you mean.
Is there any way that these kinds of things might be controlled, or perhaps in a cafeteria, you know,
Yes.
where you, did you look at that,
Yes,
from that perspective? What did you find in reference to
Well, in reference to this, you're absolutely right. We find in at all of the different places, you might have vending machines that might have, you know, sodas or nabs and things that are high in fat with trans fat in. That needs to be changed. We've seen that on the more national level now, that many places like McDonald's and other fast food restaurants are having to show the calories that's in a hamburger or a cheeseburger or some of their diet. But those things, I think, will help people make better choices at what they're eating and how many calories they're getting out of one hamburger that might be 500 calories, and if you get on a treadmill for 30 minutes, you might burn for 300 calories, and then if you're eating more all day, you haven't really helped your situation in overweight. So yes, I think these things need to be changed. We need to identify that, and I think parents for younger children need to understand that they need to not allow their children to eat at these vending machines, and if we're not doing it, they'll take them away. But yes, I think a lot of attention has been focused on that. I think here in the state of Tennessee, I've heard our governor and our mayor talk about this as an issue, and indeed they are wanting to try to change some of the things within the school systems for better eating. But it's not a school system problem. I want to be perfectly clear from a sociological point of view. It's a home problem, and we have to change what's going on at home. The kids that are on the bus going to school are not getting obese by being there because they've changed PE. It's at home. And what we're eating there and what we're not eating there correctly and what we're not doing is exercising. The data actually shares that if you see an obese child, about 50% of the time there's going to be one obese parent within that particular family. You see, so there's this endearing relationship that's going on that is causing the child to eat and overeat, and we're living in a sedentary society where instead of them exercising, they're playing with video games and doing those types of things rather than riding their bikes or running and climbing a tree or running up a hill having fun doing that. They're abstractly thinking they're improving on something by getting a higher score, sitting down at the television with video games. So this is one of the causal factors related to it.
I tell you. And
yes.
Well, it seems to me that it's almost